morning. Welcome to this session on the awards, and we're giving out the Distinguished Awards today. And I'm pleased and privileged to be able to introduce you to Bill Neigher, who is the recipient of the Division 27 Community Psychology Award for Distinguished Contribution to Practice. I'm going to read from the nominating letter that was written by Mo Elias. William Neigher is a community psychologist specializing in strategic planning, program development, and evaluation research. He has worked in these areas with the United Nations, the U.S. Senate, Harvard University, the National Institute of Mental Health, the World Health Organization, Hoffman La Roche, and Memorial Sloan Kettering Cancer Center. He has held positions in senior management and as a consultant in health and human services. Bill received his BA with honors in psychology from the University of Massachusetts and his MA and PhD in psychology from Yeshiva University in New York. He is a fellow of SCRA, APA, and a past president of the Eastern Evaluation Research Society, New Jersey Program Evaluation Action Association, and the New Jersey Association of Mental Health Agencies. He has also served on the SCRA Finance, Fellow, Program, Cowan, and Califat Award Committees. He's a busy guy. The advisory board of the Global Journal, and as a member of the practice and community health interest groups. Bill just ran for president of SCRA. In his role as leader of the practice group, Bill has put forward the concept of values proposition for community psychology and community psychologists, and these have had a pivotal influence in shaping recent growth in the field. His publications include articles in the American Psychologist and Evaluation and Program Planning, among nearly 50 books, chapters, and journal articles. A consultant to federal and state governments, he served as chair of the Federal Grant Review Committee for the SBI Research Program at NIMH under PL 97-219. He currently directs strategic planning for the Atlantic Health System in New Jersey, and in that context forges numerous community relationships and collaborations, which include most recently one between United Way, Verizon, and SCRA, focused on the community psychology value proposition. Bill also has been serving for the past year on the executive committee of the Society for Community Research and Action, and as president of that committee, I can attest to his substantial and continued contributions, which I greatly appreciate. Bill is a genuine example of what a community psychologist can do from a career based fully in the context of non-academic practice settings. Bill, congratulations.
Thank you, Pat. Looks much like this. Actually, what I should do is just quit while I'm ahead, Pat, and sit down and thank you all very much for those kind words, and also to Maurice Elias for his nomination, and to the rest of the group as well. My name is Bill, and I'm a community psychologist. I didn't start out to be one, but I became one anyway. You can blame or credit Emory Cowan and his work, values, and support. How many of us have paid him that tribute in the past? But remarks these days often start with disclosure statements. So in that spirit, let me tell you that in spite of having a doctorate in philosophy, I have never taken a course in philosophy. And after completing my doctorate, I continued to teach college. I have never taken an education course either. I most recently taught community psychology to doctoral students at Rutgers Graduate School of Applied and Professional Psychology. I have never taken a course in community psychology. And other than my time spent teaching and in consulting, most of my career has been in senior management, in health, and in human services. Guess what? So at this point, you probably are thinking, doesn't anybody in HR ever check this guy's credentials? My doctorate's in social psychology. So what's the point here? Where did I pick up the skills and competencies of our craft and our profession? Well, I wasn't born with them. We're not always well trained in them. In fact, I learned them on the job from many of you, and believe it or not, from teaching others. And as you heard at the session on Thursday in the value proposition, not all of us are good at proficiency or experience in using all of them. But we can learn them. And together with others in different fields with shared values, try to make positive change, and we can go to the community toolbox for a fantastic resource. At Swampscott, our founding fathers and one founding mother, Lulene Anderson, realized that there were not enough clinicians to treat current, let alone future problems. We need a different paradigm, they said, and others to help. Today, a bold SCRA vision seeks to have strong global impact. With about 852 members, we will need a bigger boat and more to row. One of the selection criteria for this award is someone who has managed health and human services. In other words, has done little or nothing by himself, but had the good judgment to enable the good work of others. Don't feel sorry for me. Management is an honorable profession. Well, anyway, it's a profession. Well, at least it's a living. No phony self-effacing dribble here. That's what management is, getting work done through other people. If you think about it, the values of community psychology and SCRA have similar attributes. Invest in the empowerment of others. Then again, there's the messy problem of the real world. As Kurt Lewin famously said, there's nothing so practical as a good theory, and I quickly learned its corollary. In theory, there's no difference between theory and practice. In practice, there is. And totally unprepared for practice, I was. I always figured I'd have a career as a college professor, but quickly figured out after several years of teaching at the City University of New York that I really didn't know very much and had done even less. A flawed federal initiative in community mental health, based on an inadequate social experiment in Scandinavia, richly funded and poorly executed, gave me my opportunity. President Kennedy's initiative for a bold new approach to mental health care in America led to the passage of the Community Mental Health Centers Act. These federal funds included an indirect service, consultation and education, as well as training and research and evaluation. And in the beginning, they did not have to pay for themselves. They were fully funded by all of you, with your tax money. Thank you. Two psychologists profoundly influenced my career, my way of thinking about psychology, and my values and orientation. Emory Cowan, president of SCRA in 1975 and a founder of our field, developed the primary mental health project at the University of Rochester, aimed at children at psychological risk in primary grades. He used non-professionals as child aides to work in the classroom. We have kids at psychological risk. My CMHC established a child study team leader in the Passaic, New Jersey public schools to replicate the program. We promised an evaluation before we asked for 2-year funding. As things turned out, my main effect was P equals 0.06. And I wondered on what basis we'd ask for continuation funding. I met Charles Windle of the National Institute of Mental Health at a conference. Somehow or other, I managed to whine about my dilemma with my almost significant findings. After listening somewhat patiently, he simply said to me, just because it isn't publishable doesn't mean it isn't actionable. Duh. A major insight beyond my immediate comprehension, he asked me what harm the program might do if it continued, even if the odds ratio was that there was no real difference between the pre- and post-intervention measures 6% of the time. Another of our past presidents, in a well-regarded book on community mental health, cited a dozen principles as guidelines. The final one said, regardless of where your paycheck comes from, think of yourself as working for the community. I soon realized its perilous corollary, think of yourself as unemployed. Showing your organization's dirty laundry in public, regardless of regulatory direction to the contrary, will not win favor with your boss. In Advice for Trapped Evaluators, Chuck Windle and I described 3 contrasting purposes for internal program evaluation: advocacy, accountability, and amelioration. Applied concurrently, the ethical challenges for the evaluator were significant. By negotiating up front with administration, program directors, and trustees, the evaluator can apply one model with consistency and, in the best case, impunity. 3 individuals who worked for me helped change the world and taught me the valuable lesson of empowering others while ignoring everything I ever told them to do. John Califat was Director of Training and Education for the Community Systems Division of St. Clair's Hospital, CMHC. He was my employee, my friend, my colleague, co-author, constant source of annoyance, and director of our postdoctoral fellowship, Community Psychology, for 7 years. During that time, we continued to teach and to learn from others. One of our postdoctoral fellows, standing at the right, Ken Madden, went on to become president of SCRA in 1998. Seymour Saracen, then at Yale, was one of those who came to share his experience, both as a leader in our field and to help us understand the difficulties of dealing with school systems and with community agencies, as Seymour had made a lifetime of experience for us. John was an SCRA fellow, a past president of the American Association of Suicidology. John introduced me to the phrase, "Forgiveness is 9 times easier to get than permission." Unfortunately, he was talking about me. The John Califat Award celebrates his contribution to our field as a teacher, mentor, trainer, and researcher. Ed Madeira conceived and developed the New Jersey and the American Self-Help Clearinghouses, developing over 1,100 self-help groups, serving more than 100,000 people in its 30-year history. Former Surgeon General C. Everett Koop said this about Ed: "I don't know any single person in the United States who has done more for the self-help movement or who is recognized by more people as the individual who stands most strongly for the benefits of self-help and mutual aid." Ed Madeira won this award, Distinguished Contribution to Practice, from SCRA in 2001. Sidney Greenwald. I hired Dr. Greenwald to help us design a continuing care retirement community. Recognizing my incontrovertible lack of experience, he took me to visit one of the more than 40 skilled nursing facilities he had owned or operated during his career. We ran into an older gentleman on a tour, a man from housekeeping with a mop and a pail. He greeted Sidney warmly. "Tell my friend Dr. Neigher," he said. "What do you do here?" "I'm in infection control," he said. And he proceeded to tell me with pride about getting down on his hands and knees behind every toilet, scrubbing as best he could every day of his shift in order to prevent infection and even death from that awful scourge to those patients that were part of the nursing home. That lesson, why Sid really brought me there, was that our employees need to be owners, not renters. Their buy-in to the mission and vision of the organization is critical to success. For most of the past 3 decades, I've worked with Joe Tronfio as my direct report. Now President and CEO of the Atlantic Health System, Joe got his doctorate and trained as a clinical psychologist. But importantly, he did a postdoctoral fellowship in community psychology with SCRA's first president in 1967, Bob Reef. Joe enabled everything we did, protecting us from the medical staff and the medical model when he could, and helping us move from soft money to funded positions. One person in leadership position can make all the difference. Today, Joe leads 11,000 staff, 2,100 volunteers, and 2,300 members of our medical staff. In the 2011 Fortune magazine list of the 100 best places to work for in America, Atlantic Health employees rated us number 54, ahead of the Mayo Clinic, Starbucks Coffee, Aflac, I can't do the duck, Adobe, and interestingly enough, Microsoft. Let me end with a few comments about the future. With healthcare reform, the Patient Protection and Affordable Care Act, comes a number of opportunities to apply the values, principles, and toolkit of community psychology. For one, population-based interventions target health promotion and illness prevention. In other words, wellness at the community level. It addresses directly the current perverse incentives of reimbursement based on the volume of procedures and testing, and moves us to episodes of care based on efficacy and efficiency. Some of these are in the slide behind us. A community psychologist may soon be the most important new hire a Blue Cross Blue Shield insurance company can make to reduce the incidence of prevalence of juvenile diabetes. Several years ago, an external consultant to our organization offered me some good advice. Being right doesn't matter. You don't have a paying customer for this. Dan Fishman and I wrote an article in the American Psychologist entitled American Psychology. Who will buy? It asked the same question. Is there a paying customer out there for our services, absent government and grantor subsidy in